Bismillahirrahmanirrahim. Rabbi zidni ilma. Quote of the day. Difficult and meaningful will always bring more satisfaction than easy and meaningless. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and under the supervision of Professor Dr. Saira Afzal, today my topic of presentation is blindness. Learning outline includes the introduction, problem statement, its types, prevention and control, recent updates, and multiple choice questions. At the end of this presentation, participants will be able to describe blindness, epidemiological factor, and its prevention and control. Problem statement. 82% of all blind people are aged 50 years and over. 1.4 million are children, 5.8 million aged 15 to 49 are females, and 32.2 million aged 50 plus. Plus 1 billion disabled people in the world. Out of them, 6% of the world population is affected by deafness or have hearing loss. 1% of the world's population need a wheelchair. 2.6% of the world's population has an intellectual disability. And 17% of the world's population is affected by blindness. The world's population, 7.3 billion, out of which 36 million people are blind. 217 million people are with moderate to severe visual impairment is equal to total 253 million people are visually impaired. There is change in the prevalence of visual impairment. As you can see, in 1990s, it was 4.58%. Now in 2015, it was 3.38%. 55% of the visually impaired people are women. And 89% of visually impaired people live in the low and middle income countries. 1.1 million people with near vision impairment just need simply because they don't have a pair of spectacles. These are the different causes of the visual impairment. I will discuss them later. One good thing is that more than 75% of the visual impairment is avoidable. If we see the global distribution of blindness by cause, these are in the developed countries and these are in the less developed countries. And you can see in less developed countries, 50% is the cataract, whereas in developed countries, it is age-related macular degeneration is the cause, which is 50%. And the remaining causes are this. In this cataract is 5%, we have 50%. And you can see difference between the causes of the developed and underdeveloped countries. We talk about the blindness and visual impairment. In blindness, you can see 68.11% are treatable. This 10.90% is preventable, and gray area 13.89% preventable by with some ophthalmic services. And this 7.10% is unavoidable. Whereas as we talk about the visual impairment, 85.7% is treatable. And only this yellow chunk, which is 3.8, it is not treatable, unavoidable. If we see the causes of global blindness, there are 45 million, in which 60% is cataract and refractive errors. 15% is trachoma, vitamin A deficiency, and onchocerciasis. 15% with diabetic retinopathy and glaucoma, and age-related macular degeneration and other causes lead to 10% of the total cause of global blindness. These are the key facts by the WHO. It said globally at least 2.2 billion people have a near or distance vision impairment. In at least 1 billion or almost half of these cases, vision impairment could have been prevented or has yet to be addressed. The leading cause of vision impairment and blindness are uncorrected refractive errors and cataracts. So one thing is for sure, the cataract and uncorrected refractive errors are the main cause of the visual impairment and blindness. The majority of the people with vision impairment and blindness are over the age of 50 years. However, vision loss can affect people of all ages. Vision impairment poses an enormous global financial burden, with the annual global cost of productivity losses associated with vision impairment from uncorrected myopia and presbyopia almost estimated to be US dollar $244 billion. In Pakistan, cataract is the most common cause of blindness, 51.5%, which is defined as less than 3/60 in the better eye on presentation. followed by corneal opacity, which is 11.8%, uncorrected aphakia, 8.6%, and glaucoma, which is 7.1%. The WHO defines blindness as visual acuity of less than 3 by 60, which is inability to count the fingers at a distance of 3 meters, or corresponding visual field loss in the better eye with best possible correction. Uniocular blindness is not blindness because the other eye is normal. Definitions. The International Classification of Disease 11/2018 classifies vision impairment into two groups, distance and near presenting vision impairment. Distance vision impairment includes a mild visual acuity worse than 6 by 12 or 6 by 18, moderate visual acuity worse than 6 by 18 or 6 to 6 by 60, severe, which is visual acuity worse than 6 by 60 to 3 by 60, and the blindness, which is visual acuity worse than 3 by 60. Near vision impairment is near visual acuity worse than N6 or M.08 at 40 centimeters. Normal vision. Visual acuity is usually measured with a Snellen chart. The Snellen chart displays letters of progressively smaller size, which in the normal vision is 20 by 20. This means that the test subject sees the same line of letters at 20 feet that a normal person sees at 20 feet. As you can see, this is Snellen's chart, and it is the 20 by 20 vision, which is normal for everyone. You can see the alphabets are decreasing in size as we go in the lower side. Definition of visual impairment. Visual impairment is defined as the limitations of action and functions of the visual system. The National Eye Institute defines low vision as a visual impairment not corrected by standard glasses, contact lenses, medication, or surgery that interferes with the ability to perform activities of daily living. Types of blindness are the economic blindness, social blindness, manifest blindness, absolute blindness, curable blindness, preventable blindness, and avoidable blindness. What is visual acuity? It is a sharpness of vision measured as maximum distance a person can see a certain object, divided by a maximum distance at which a person with normal sight can see the same object. Whereas economic blindness is an inability of a person to count fingers for a distance of 6 meters or 20 feet. Social blindness, vision 3 by 60 or diminution of field of vision to 10 degrees. Manifest blindness, vision 1 by 62, just perception of light. Absolute blindness, no perception of light. Curable blindness, that stage of blindness where the damage is reversible by prompt management, for example, cataract. Preventable blindness, the loss of vision that could have been completely prevented by institution of effective preventive or prophylactic measures. Legal blindness is a level of vision loss that has been legally defined to determine eligibility for benefits. The clinical diagnosis refers to a central visual activity of 20 by 200 or less in a better eye with the best possible correction and or a visual field of 20 degrees or less. So the thing to remember is legal blindness has the value of 20 by 200. Causes of blindness globally. Cataract, glaucoma, diabetes mellitus, vascular disease, accidents and degeneration of ocular tissue. Leading cause of childhood blindness includes xerophthalmia, congenital cataract, glaucoma, and optic atrophy. If we see the global blindness, you can see the cataract as a main chunk in it. Then the childhood blindness around 3.3, trachoma, 12.5, oncocerciasis 0.6%, and other causes, which includes the glaucoma, age-related macular degeneration, trauma leads to 37.5%. One more diagram splitting the more causes: cataract 48%, glaucoma 12%, acute age-related macular degeneration 9%, and you can see diabetic retinopathy 5%, childhood blindness, and others. Again, the cataract is the one of the leading cause of the blindness. Epidemiological determinants. Age. In children and young, refractive error, trachoma, conjunctivitis, and malnutrition. In adults, cataract, refractive errors, glaucoma, and diabetes mellitus. It is highly prevalence of trachoma, conjunctivitis, and cataracts in women, leading to high prevalence of blindness in women. Malnutrition, infectious disease of childhood, especially measles and diarrhea. Protein energy malnutrition, severe blinding cornea destruction due to vitamin A deficiency in first 4 to 6 years of life. Occupation, people working in factories, workshop, industries are prone to eye injuries because of exposure to dust, airborne particles, flying object, gases, fumes, and radiations. Social class surveys indicate that blindness twice more prevalent in poorer classes than in the well-to-do. Social factors include the basic social factors are ignorance, poverty, low standards of personal and community hygiene, and inadequate healthcare services. Prevention of blindness. The components for action in national programs for the prevention of blindness comprises the following: initial assessment, methods of intervention, which includes a primary, secondary, and tertiary care, and the long-term measures. Methods of intervention include the primary care. Wide range of eye conditions can be treated or prevented at grassroots level by locally trained health workers who are first to make contact with the community. They are also trained to refer the difficult cases to near primary health care or district hospitals. Their activities also involve promotion of personal hygiene, sanitation, good dietary habits, and safety in general. Then the secondary care. It involves the definitive management of common blinding conditions as cataract, trichiasis, entropion, ocular trauma, and glaucoma. It is provided in primary health care centers and district hospitals where eye departments are established. May involve the use of mobile eye clinics. Tertiary care. Established in the national or regional capitals and are often associated with medical colleges and institutes of medicine. Provide sophisticated eye care such as retinal detachment surgery, corneal grafting, which are not available in the secondary centers. Other measures of rehabilitation comprise education of the blind in the special schools and utilization of their services in the gainful employment. Specific programs related to our blindness are the trachoma control program, school eye health services, screening and treatment health education, vitamin A prophylaxis, and occupational eye health services. Long-term measures include the aimed at improving quality of life and modifying the factors responsible for eye problems. It includes a poor sanitation, lack of adequate safe water supply, poor nutrition, and lack of personal hygiene. We have to address all these problems. Vision 2020, the right to sight. The Right to Sight is a global initiative for the elimination of avoidable blindness, a joint program of World Health Organization, the International Agency for the Prevention of Blindness. It was launched in 1999 to promote a world in which nobody is needlessly visually impaired, where those with unavoidable vision loss can achieve their full potential. The global initiative aims to intensify and accelerate prevention of blindness activities so as to achieve the goal of eliminating avoidable blindness by 2020. It sought to do this by focusing on certain diseases which are the main causes of blindness and for which proven cost-effective interventions are available. Global Action Plan 2014-19, Universal Eye Health. The Global Action Plan was unanimously adopted by member states at the World Health Assembly in 2013 as a part of WHO resolution. The vision of the gap is a world in which nobody is needlessly visually impaired, where those with unavoidable vision loss can achieve their full potential and where there is universal access to comprehensive eye care services. The goal of GAP was reduce visual impairment as a global public health problem, secure access to rehabilitation for visually impaired services. And the objectives of GAPs are to develop and implement integrated national eye health policies and plans, ensure multi-sectoral engagement and effective partnerships. Pakistan National Program for Prevention of Blindness, it focuses on upgradation of services at district FSC level to help in eradicating blindness from country, and also the upgradation of eye departments of the teaching hospitals. If we talk about the eye care advised by WHO, the facts are 253 million people are visually impaired. 81% of people are aged 50 years and over. 84% of the visual impairment results from chronic eye diseases. And the consequence of real impairments leads to 3% likely to be unemployed, 3 times more likely to be involved in a motor vehicle collisions, 3 times more likely to suffer from depression and anxiety disorders, and 2 times more likely to have a fall when walking. And the opportunities are 81% of the visual impairment could be avoided if diagnosed and treated early. 1.4 million children could benefit from visual rehabilitation, and 102 billion US dollars could be saved with appropriate eye care services. And the action should be assess the availability of eye care services, identify needs and gaps, provide high quality and affordable eye care services to all, inform people about eye disease prevention and care, and educate about importance of regular eye examination. So these are the eye conditions. Some eye conditions do not typically cause vision impairment. Other can. The common which do not are the eyelid inflammation, cyst, conjunctivitis, benign growth, dry eye, subconjunctival hemorrhage. And some of the eye conditions which can cause visual impairments are cataract, general opacity, glaucoma, trachoma, age-related macular degeneration, diabetic retinopathy, and refractive error. These are the most common causes of it. The burden of eye conditions and vision impairment is often great among people living in rural areas, people with low income, women, older people, people with disabilities, ethnic minorities, and indigenous population. And the risk factors, some are non-modifiable, which are genetic, aging, and some are the modifiable, which are the lifestyle modification, like good nutrition, occupational health, smoking, avoid smoking, and the environmental factors related to hygiene. So the problem, and there should be availability, accessibility of the people, and the eye services can be fully integrated, properly integrated into the health system. And the recommendations that make eye care an integral part of universal health coverage. Implement integrated people-centered eye care in the health system, promote high-quality research, monitor trends and evaluate progress, and raise awareness and engage and empower people and communities. So the key facts about blindness and visual impairment is 1.3 billion people live with some form of visual impairment globally. 80% of all vision impairments considered avoidable. If we see the cause, 36 million are blind, 188.5 million are with mild, and 2.7 are moderate to severe visual impairments. 826 million people with living near vision impairment, and the 50 plus mostly impaired with age at this age. Top 5 leading causes of visual impairment is the first is URA, which is uncorrected refractive errors. By just having the glasses, their impairment, their vision can be improved. Then the cataract is one of the most leading cause. Then age-related macular degeneration, glaucoma, and the corneal opacities. Recent updates. So we see the severity level of the myopia. Myopia is basically the nearsightedness. One can see the objects near to the eye very clearly, but when the object goes farther away, it becomes blurry. So you can see simple the percentage in 2010 and 20. You can see this orange one was the low to moderate myopia. Red was high myopia and green was non-myopic. And you see by the years are increasing, the green color, which is so non-myopic, is decreasing, and by 2050 you can see half the myopics will be more than 40%. You can say it here. So the trend of refractive errors is increasing as the years are passing, and it is predicted in 2050 40% will be myopic. In PLOS ONE, it was an article, a comprehensive study capturing vision loss burden in the Pakistan 1990 to 2025, findings from the Global Burden of Disease 2017 study. This study aimed to provide estimate trends and projections of vision loss burden in Pakistan from 1990 to 2025. Global burden of disease, injuries, and risk factors. This study in 2017 was used to observe the vision loss burden in terms of prevalence and year lived with disability. As of 2017, out of 207.7 million people in Pakistan, an estimated 1.12 million people were blind. And visual acuity were less. People had severe vision loss, and 6.79 million people have moderate vision loss. Presbyopia was found to be the most common ocular condition and affected 12.64 million people in Pakistan. In terms of age-related wild deer rate, Pakistan is ranked 4th among other South Asian countries and 21st among other 42 low-middle income countries. Which and the all compared with all age wildest count of blindness of vision impairment increased by 55% in 2017, which is the 10th highest increase among major health loss causes such as dietary iron deficiency, headache disorder, low back pain, etc. In Pakistan, moreover, our statistics show an increase in vision loss burden by 2025, for which Pakistan needs to make more efforts to encounter the growing burden of eye diseases. She is Pakistan's first blind diplomat wins appreciation from United Nations General Assembly speech. Sheikh Saima Salim, 37 years of age, described herself the first blind civil servant of Pakistan and a diplomat from within. With diplomat with insight, not sight. She fought for her right to become the first visually impaired person to serve overseas in Pakistan Foreign Services. At every step of the way, from CSS examination to service as foreign services officer, she refused to be held back by obstacles and broke all with invisible barrier to carve her path and joined the foreign services in 2008. Now moving towards the multiple choice questions. The crude prevalence of blindness was age and gender standardized by using the most recent official population estimate. The most common cause of blindness in Pakistan is cataract, glaucoma, macular degeneration, and diabetic retinopathy.
A. Cataract.
Yes, the correct answer is cataract. The visual acuity test is used to determine the smallest letter you can read on a standardized chart held 20 feet or 6 meters away. This chart helps in the assessment of one's level of vision and is called legal blindness, eligibility, low vision chart, Snell's chart, accommodation chart.
Sneller's chart.
Snell's chart, yes, correct. When someone is legally blind due to visual acuity, it means that the sharpness of their vision cannot be improved even with the help of prescribed glasses or contact lenses. What is the visual acuity of legal blindness? 20 by 20, 20 by 70, 20 by 200, 20 by 100. The correct answer is 20 by 200. A student XYZ was doing experiment in the chemistry laboratory and unfortunately her test tube blasted and she got chemical splash in her eyes. The best immediate treatment for a chemical splash to the eye is neutralization of the chemical with an alkali, cold compresses, ocular lubricants, copious irrigation with water.
D.
Yes, the D is the correct answer. One should immediately wash the eye with water. Onchocerciasis is a neglected tropical disease caused by the parasitic worm and transmitted by the bite of black flies. Onchocerciasis is one of the common cause of diarrhea, hydrated cyst, blindness, liver granulomas.
C.
C, yes, C is the correct answer. A patient 60 years old comes to medicine OPD with the history of diabetes mellitus from last 30 years with the presenting rate of gradual loss of vision from last 1 year. Physical examination shows various venous dilatations and retinal hemorrhages. Which of the following is the most probable cause of this condition? Glaucoma, macular degeneration, retinal detachment, or diabetic retinopathy?
Diabetic retinopathy.
Yes, correct. Mr. Ahmad, 63 years old, had a complaint of vision loss from last few months. As low vision is a vision loss that cannot be corrected with glasses or contact as it is not blindness because limited sight remains. What is the main cause of his low vision? Glaucoma, age, cataracts, too much screen time.
C.
Yes, see, cataract is the most common cause. And there's not complete blindness, there's some sight remains in it. A patient in IOPD has an examination of the eye by the doctor while keeping his head still to get a better understanding of his vision field. How can doctor describe the patient about his vision field? The amount of space you can see in front of you, the amount of space you cannot see in front of you, what place you are looking in, a field that you can see better in.
D.
No, the correct answer is A, the amount of space you can see in front of you. Vitamin play a crucial role in vision by making a clear cornea and also component of protein in your eye that allows to see in low light condition, and also its deficiency can lead to night blindness. This vitamin is vitamin A, vitamin B, vitamin C, or vitamin D.
A.
Yes, A is the correct answer. Since the 1960s, Sri Lanka has become the major donor of eyes to more than 58 countries. Buddhism play an important role in encouraging and teaching people that eye donation is a way of giving. Which part of the eye is transplanted from eye donation? Lens, retina, iris, cornea.
Cornea.
Cornea, yes, correct. This is my key. These are the references. And thank you so much.